Okay.
Hi, I'm Dr. Amy Zabin, music therapist, and Dr. Joe, it is always a pleasure to hear about the latest medical developments.
Absolutely. So today is a study that was published in this week's journal of the Journal of the American Medical Association. It's a very prestigious journal. And what it was looking at was, it was a large study, large trial done in China. Had over 20,000 people, and all of the people had one thing in common. They all had high blood pressure. What they did, it was called the Chinese Stroke Primary Prevention Trial. And what they did is that they took these 20,000 people and they divided them into different groups. One of the groups was given a blood pressure pill, very common, called enalapril. And with the enalapril, they were also given a high dose of folic acid, 800 micrograms.
Wow.
And the second group was just given the folic acid. And what they did is they then followed these people over a period, this is 20,000 people, over a period of 4.5 years. And what they found was absolutely fascinating. The risk of having a stroke over the next 4.5 years was 3.4%. if you were taking the enalapril and the folic acid.
Both, okay.
Yeah. So if you have 100 people in this study, 3.5 of them would have had a stroke over the next 4 or 5 years. If you were just taking the folic acid, the risk of having a stroke was less than that. It was actually 2.7%, which is only 2.5 people. So there was an extra 1 person who wouldn't have a stroke being only on the supplement.
Which is amazing, because obviously taking a supplement is a little bit less dangerous than taking a prescription drug. And with a huge sample, 20,000 longitudinally, 4.5 years, this is very powerful.
This is definitely, but the most important point of the study, in my opinion, is that this reduction was seen in patients who had a low serum, a low blood level of folic acid. So everybody was checked to see whether their natural folic acid level was high, low, or medium. And what they found is that if it was low, those people would do best if they were given folic acid supplementation. So that doesn't mean that everybody should take folic acid and not take a blood pressure pill. It means that if your folic acid is low, then taking folic acid may help with your blood pressure and, more importantly, with your risk of stroke.
So it's not to say, like with pregnancy, where everyone pretty much takes folic acid. You need to get it checked. And especially with people's diets so radically changing these days, people being on diets, changing their eating habits dramatically, everyone should get their folic acid level checked and then perhaps be at a lower rate for stroke. That's amazing.
That's exactly it. Supplements should not be taken willy-nilly. You should get baseline labs to see if you need them. They have to supplement a healthy diet. And just by the way, folic acid is found in lots of green leafy vegetables. It's also found in legumes. It's found in certain whole grains. And it's also fortified in many foods. So in the United States, you're much less likely to get a folic acid deficiency, but that's not the case in China.
Absolutely, absolutely amazing. Thank you so much.
Thank you so much.